Hey everyone, this is Nick Cook, Director of Public Policy for the Michigan Coalition Against Homelessness, and I want to welcome you to the first ever podcast of Unhoused and Unfiltered. I am joined here with my colleague, Sarah Rennie.
Hey everybody, thank you so much for tuning in. I'm Sarah Rennie. I'm the Senior Director of Engagement and Advocacy, and I am super excited to talk to you about the issues that are facing the unhoused and precariously housed in Michigan.
You know, this is great. I'm just so excited to be doing this. We've talked about this. You and I have been on the job since July of this past year, and we've been talking about this, just getting ready to have these conversations because so much is going on. And, you know, Sarah, this is just, I think it's time for us to elevate the conversation.
Absolutely. My 13-year-old was really skeptical this morning. She's like, why are you doing this? And I was like, because people really don't understand what folks are facing, particularly folks that are in poverty, low-wage workers, and people are really facing a lot of hardships in Michigan. And it's important that we talk about that in a way that's real and authentic to our state.
Yeah, I mean, it's funny you say that because all the time when you and I are talking to people, we hear, well, I used to never see homelessness in my community. I never knew anybody that was homeless. Now I do. And we're just seeing it more and more and more. And the more we have these conversations, the more people want to know what are the solutions.
Well, I think that's an important point. When you look at the data in Michigan, we all know somebody who is one paycheck away from homelessness. 40% of Michiganians, or Michiganders.
We're going to have fights about that the whole time.
Are living paycheck to paycheck, and all people can't afford the rent. They can't afford food. Wages are flat, and rent is just increasing. So we're looking most recently at 30,000 people who are unhoused in Michigan. The leading populations that are increasing are not what you think. It's families, mothers and kids. Our veterans are particularly at risk, which is just unacceptable. And we're seeing a lot of youth homeless. Again, because wages have been flat and you can't afford housing.
Right. And you brought up a great point on the housing piece. We have a housing shortage in Michigan.
That's right.
We heard it in the governor's state of the state talking about housing. We saw it in the budget recommendation that the state budget office. We even heard President Trump at the State of the Union talk about the housing crisis in the United States. So
it's baffling, right, that nobody ties that to the increase in homelessness, and then somehow, if you're precariously housed, if you're living paycheck to paycheck, you're our neighbor. But if you're someone who's now sleeping in their car because they had a major medical bill or their kid, had some other major issue, suddenly they're different. And so we're going to need holistic solutions to really address the economic crisis that our communities are facing.
Yeah, it's, we've seen it across the state. We've had conversations with different communities, you and I, and each community does have different solutions in mind.
Right.
And we know some work.
And some do not.
Some do not. And I think this is going to be a larger conversation going forward. So I really appreciate that because we're seeing this pattern across the country.
Yes.
We have this new think tank out there, Cicero Institute, put out by John Lonsdale, the co-founder of Palantir.
Yeah.
That is saying housing first doesn't work.
Well, let's explain to folks what housing first is and what it isn't first. So housing first is the idea that we are going to get someone into shelter, off the streets, and get them supports kind of at the same time. We're not going to make them sort of try to earn supports in housing by getting clean or getting mental health treatment or getting domestic violence supports, because it's impossible if you're living, I want you to imagine, living in a car with your kids, and it's impossible to then balance all these other requirements if we also don't have somewhere safe. So housing first is not housing alone. It's let's get folks stably housed and then continue to provide supports on some of the other issues.
I think a lot of us forget what we learned in Psych 101 in college about
Absolutely.
the hierarchy of needs.
Yep.
And shelter is right there at the top. And
and safety and stability, right?
Yeah, so that's a great point. And, when we talk about housing first on a national scale, we have this think tank coming out there saying housing first doesn't work.
That's right.
But what data do they have? They really don't have data from what I've seen.
They don't. In fact, we know that housing first does work. It's 84% become and stay housed if you do the housing first model and you fund it completely. One of the things that we hear a lot is, well, if it's working, why are there so many unhoused folks? And it's for those reasons we just talked about. The economy is not... the Dow Jones does not reflect what you and I are living, or what my kid who's a custodian are living. We may have great stock market, but my kid who's a custodian, he pays half his rent. That used to be a job where you could actually support yourself, right? He pays half his income in rent.
Yeah, it's funny, when the governor announced the affordable housing crisis and her plan, I was listening to a news interview with some real estate developers, and they consider affordable housing in Michigan $300,000.
I'm not sure my nonprofit salary is getting to the affordable housing.
Yeah, I don't know a lot of people that could, on one income, could afford a $300,000 home, let alone somebody that has challenges that have come up in their life, either through medical debt, loss of job, injuries.
And I think that just shows, both with the Cicero Institute and with respect to all of our elected officials, how out of touch they are with the realities of folks who are just working and trying to live. There's a huge gap between the people who are thinking about these laws and the folks who are living them, which is why we wanted to do this podcast, to really talk about what we see. And one of the things I'm really excited about hearing, and I know it's a little bit off our chart, is one of the things I'm excited to hear about is your work going out to the homeless camps, because you see day to day what folks are suffering in a way that people in think tanks just can't.
Yeah, we see it all the time. I mean, especially where you and I work in the advocacy world and the public policy world, is communities think they know a solution, or people think they know the best way to address the solution, and till they get out there and actually boots on the ground, interact with the individuals, it really, there's that disconnect.
And I think that's the biggest message we're going to have as we go forward in these podcasts is, don't these people, these are just folks that we grew up with. These are community members. They have had as many hardships and challenges as you have or anyone else has had. And we may have had the benefit of a little better luck. But it doesn't mean that anyone listening to this is not potentially vulnerable to some of the challenges they faced.
Right. Yeah. I mean, we're all one bad week, one bad month away from being in their shoe, in an unhoused person's shoes. If not us, our children, our parents. I mean, like you said, we're seeing increase in senior citizens.
Yeah. Which is one of the heartbreaking things, because Social Security simply doesn't cover the cost of rent for many folks. And so we're seeing a lot more seniors who have to make a choice between food and housing. And the cuts that are coming in food stamps and Medicaid aren't really going to help. So it's really important, as we set the stage, to really understand that this is not we don't have a homeless issue. We have a housing and poverty issue, and not separate or other folks who are just living on the street now.
Yeah. I mean, you're exactly right. And we have to identify, the root causes.
Yes.
And, that's kind of why I came into this role. I know we both took different journeys to get here.
Yes,
you're
a little bit yours for.
Yeah. So, I was in the Army for 13 years. Returned back home to Michigan. I was born and raised in Lansing.
I'm so glad you did. I'm really lucky to have you.
But, I came back and I just couldn't find something that motivated me on the level of my service in the Army. And, I worked for an engineering firm, great firm. I worked in state government, loved it. But I just couldn't find that thing to drive me. And my master's degree is in legislative affairs. I reached out to the state Senate, or actually the state House of Representatives, looking for a job. Landed with State Senator Sylvia Santana. Then she was the state rep from Detroit. Loved working, saw vulnerable communities on a daily.
She must have represented significant.
Yeah, there was significant challenges. We had some of the poorest zip codes in the state, and we had some of the richest with Dearborn. And Dearborn was even divided. You had a bifurcated city.
Absolutely.
You had a very rich part of Dearborn, and you had a very poor part of Dearborn. And to see those vulnerable communities and see how the challenges they faced on a daily basis, from getting their kids to school to finding food for their family to getting a job, just always ate at me. And I had this opportunity about 2 years ago. My daughter was in preschool, and her best friend, her dad approached me and said, "Hey, I'm a veteran. You're a veteran. I do homeless street outreach in the middle of the night. You want to go out with me sometime and see what it's like?" And immediately I fell in love with the work. I fell in love with the people that I met. They were just like me, just like you, but again, a bad situation, bad month, bad day.
And the connections you made with them makes a difference.
Yeah.
Part of your work is just being human.
Yeah, they wanted dignity and respect, and a joke and somebody to check up on them, and
they want what we want, which is community and care and
connection. And I fell in love with it. And the opportunity to jump over to MCAH opened up this past summer, and after 7 years with Senator Santana, I had a conversation with her, and I made the jump full time into Michigan Coalition Against Homelessness, and I feel invigorated. I love this job. I love the work. I love the connection to the people. And at the end of the day, if we can make the lives better for just a few individuals, it'll be worth it.
And it's really great because you can apply the micro work, the direct service work you're doing, and the macro in your policy work, right?
Right.
Which is fantastic.
I mean, we always joke that I talk all the time, but I know some of your background. I mean, you're I'd be scared to sit across from you in the courtroom. But what brought you into your role?
So I have to go back a little bit further. I'm the youngest of 6. My grandma lived with us. We lived in a very tiny bungalow. We didn't have a lot growing up, and my grandmother died when I was a freshman in high school. I went through some not so great times, and I spent a lot of time with a very radical priest. I think they sent him up to the thumb to, he was very committed that to be Catholic is to be of service, and you have to be Catholic and of service to the poor first. I then, like a lot of young girls who are struggling, fell into a DV relationship, a domestic violence relationship, married young, had 2 kids, struggled. I worked my way 3 jobs to get through my undergrad, lived off and on in my car, eventually got my law degree, divorced, got 2 kids, and I started working for a legal services program. And at that point, I was so amazed by the folks I was working with. And I was able to work directly with chronically homeless folks. So I was hired from the time I was a first-year law student all the way for another 5 years. I worked directly with straight outreach and legal services.
And just a quick, we see a lot of domestic violence and homelessness, don't we?
Correct. And so part of the reason that part of my story is why I'm so passionate about this. My particular passion is that 80% of women who are homeless are victims of domestic or sexual violence. And if not for just a lot of people and supports, I would have been permanently one of them. I had 2 kids, and I was able then, to get my law degree and litigate really cool cases on behalf of folks in poverty. But I never forgot and can't forget my journey and then my commitment both through my religion and through my own experience, to making sure that we're not othering. Like I said, that young mom with the baby, that's me, or could have been me. I had a lot of, like I said, I had siblings. And I've done lots of things. I've run a DV shelter. I've litigated really complex cases, but nothing's more rewarding than the work I do one-on-one. Like you said, I sort of fell in love with the idea that by being present and accompanying people, whether I'm using the law or not, I can help folks regain a sense of who they are.
Right. And I think that's important, is that human connection.
Yeah.
At the end of the day, we want to make sure that we're connecting to each. You said there's 30,000 unhoused individuals in Michigan. I think there's probably 30,000 stories on why they're unhoused. And, when you were bringing up the domestic violence survivors, I'm thinking to the individuals, the young women I've met in our encampments. So many of them share that story.
Well, and I want to be clear. I'm Gen X. Most folks couldn't do what I did. Not because they're not able, but because the supports aren't there. The ability to work your way through college is not possible. So I could, working 3 jobs, make my rent, right? Sometimes not, not every time, but I could make it work. You can't do that now. Right. You can't leave a domestic violence relationship or just be a single father and be able to balance parenting. It is not possible. Just mathematically, because rent is so much higher than minimum wage.
Well, and I think that's why, every year, our continuums of care, our service providers do an amazing job every year. They put 50% of those people into housing.
Right.
But because of the economic concerns,
that's why
15,000 more come right back in.
So the question I usually get at this point is, what do you want? More money? And I'm like, what I want is smart investment on what we know is working, which is the continuum of care and street outreach. This work that you do, there's no replacement for getting to know the individual and helping them support. And my pitch, to domestic violence, because we're cutting domestic violence programs, and we know those programs work.
Yeah, and I think that's a good point, is we see at the federal level, the federal HUD, who oversees most of the grants that come down for homeless services, we saw that the administration is trying to reshape how that money flows to the states and what organizations it flows to. And we know that every administration at the state, federal level, they come in, they have their agenda, they want to change things. But we saw a very drastic change this year. Moving to transitional housing.
It's been sort of this elimination of compassion.
Right. And it was more about how much money can we save on these individuals.
And I think one of the things I want to just a little bit to talk about myself just for a minute is the point I made about folks not being able to do what I did. You are more likely to win the lottery than you are to change social classes now in the United States. And so as we shape programs, we need to be going towards economic stability and supporting good wages and supporting those who are already victims of this sort of economic oligarchy, for lack of a better word. And I don't think that's a shocking word anymore, as we see a rise in billionaires, and less away from just trying to save money on the backs of folks already struggling.
Right. And I think, Congress, through your work and through my work and all the continuums of care and all of our service providers, they listened.
Yes.
Members of Congress really saw that the direction HUD was going was not going to work. So
to back up, because Nick is very modest, there was a sort of a crisis on the largest funding source that comes into Michigan, $108 million, that essentially would have radically shifted and cut funding to homeless and housing supports for poor folks. And through a lot of collective effort, Congress put in the most recent THUD bill, that grant has to be paid out to while there's pending litigation, because there's a bunch of, as a lawyer, I'll tell you, there's a bunch of unconstitutional stuff there. That's a whole other podcast.
We could spend hours on that.
But could you talk a little bit more about the collective action and what you're seeing in terms of Congress hearing us?
I think that's a great point. Is the collective action across not only Michigan but across the entire country got Congress to look. We go back to when you and I say people are saying we haven't seen homeless before, so it must not be working.
Right.
That wasn't the case. Like you have been illustrating, is we've had an economic situation where rents in Michigan have increased 25% since COVID. So 2020, in 5 years, rents have gone up 25%. I know I couldn't afford a 25% increase when I was younger. I'm pretty sure most people to this day still couldn't afford to do it unless both parents are working, both have good jobs, and they have extra income.
Right. Do you think the inflation that you're seeing is contributing to some of these issues?
Yeah, I think a lot of that is causing people to live on the edge. That one bad day quickly moves somebody into homelessness. They can't pay rent because there is a housing shortage. Landlords know that they can rent their place out, so they're quicker to move towards.
So from your time in the, because you were also in the federal legislature, right? We skipped that part, but Nick is very fancy. He just doesn't talk about it. Where do you think the disconnect is between sort of what the legislators understand and what you're seeing and what we're seeing?
Yeah, I think the disconnect really is our service providers are very modest. They work on shoestring budgets. They make things happen on a daily basis that are remarkable and make those connections and get people into housing. There really has not been investments in housing. Our housing choice voucher wait list in Michigan has been closed for 2-3 years now. We have, so our service providers finally started talking about what they're doing and the stories. And I think it started to resonate that, we don't have 30,000 people that are continually the same 30,000.
These are new folks.
Every year is 15,000 new folks.
Right.
And I think that finally started resonating. And the more our grassroots, the more our service providers started talking to their members of Congress, their state legislators, it started resonating.
But that's sort of just the beginning. I think it's important because we jumped in this conversation like we often do midstream. I want to back up a little bit and make sure you explain again what the Cicero Institute and the executive orders, what you are seeing sort of from the administration in terms of the desire to criminalize folks and not provide funding for these services.
Yeah. So back to the Cicero Institute, their whole belief is if you force somebody to go into treatment or force them to do certain actions, they will pull themselves up by the bootstraps and get into housing and do everything right.
And I think you often say if you don't have bootstraps, you can't pull
yourself up.
So why should we care? But if I was like, let's say my 26-year-old son and listening to this, should I care about the Cicero Institute?
Well,
what's their power?
Well, because they're influencing communication through HUD, through the White House, and they're putting this focus on the criminalization.
Okay.
We don't want to see them. We don't want to see homeless individuals, unhoused individuals on the street. We want them in a program. If they're not in a program, we want to put them in jail or into forced mental health treatment.
And so how does that tie to the executive order that came out in the summer?
Yeah, the one at the end of July, the executive order that President Trump issued really came out and said, we don't want to see homelessness on the streets. It's for the safety and order of the cities. And it took money, reallocated it based on who was more likely to enforce the executive order. If you did force incarceration, if somebody didn't want to go into a treatment program, you could get more money. If you required mental health treatment, or inpatient mental health treatment, then you could get more money.
So it's basically like sweeping people up to get them out of sort of a downtown area.
If I don't see you, you're not there, we don't have a problem.
So what happens, like, if we like break up a camp or arrest folks, what happens to those folks?
That's the sad part. Yeah, it sounds great. We're moving that encampment away. We don't want it next to a business, or we don't want it next to a neighborhood. It's not safe. Whatever the excuse is that the people say is NIMBYism, not in my backyard. Those individuals are then pushed further into the margins. For example, they may start out in a city, get pushed out of the city, move into the township. Township sweeps them out. They might move into a college campus. That college campus then moves them out. And all this time, your social workers and the street outreach are trying to find these individuals.
To help them.
Every time.
And they're losing their belongings, right? And their medicines and their...
Yeah, I mean, you have... we've heard stories out on the streets of people losing their medication for their mental health. We've heard stories of birth certificates or social
There was a
security
national
cards.
story that someone lost their
Father's ashes.
Their father's ashes. And then if they get arrested, what happens? I mean, how do you find a homeless person to charge them?
Well, yeah, and that's the other thing is, we've seen where me as the director of public policy, I'll get a judgment against a homeless individual for sleeping in the park after dark that says so-and-so address as homeless.
So they never got noticed.
They got noticed. They never got noticed, so it ended up coming to us at the Michigan Coalition Against Homelessness, which now he has a bench warrant out for failure to pay fines, as you know.
And he's not going to pay fines, so then he's going to go to jail. And then when he's out of jail, he won't be able to get housing because he's now got a criminal record.
Correct. And you see this domino effect is...
And because both of us come from families with law enforcement backgrounds, what's the effect on law enforcement here? Because this can't be easy for them either.
It takes them away from more serious crimes.
Right.
I mean, if you think about it, if you send out a law enforcement officer to a encampment to tell them to move out of here when they're not bothering anybody or they're just trying to sleep, trying to survive, if a burglary is going on, an assault, a rape, now you're slowing down that reaction time for that officer.
Because there's no extra money in any
No,
of this.
none of it has extra money.
So this is like an unfunded mandate to law enforcement.
Yeah, I mean, you bring it up all the time, is the more we see these executive orders, the more we see the HUD direction they're going, there's no extra funding to do these programs.
So we're just pushing this to small communities and instead of helping people get where they need to go, there's no money for jail beds either, right?
No. I mean, and really, if you are law enforcement and, Bill Smith's over in the corner and he's unhoused, but he keeps to himself, why would you want to disrupt that? Why would you, as a law enforcement officer, want to go stir up that hornet's nest or force this individual who may or may not be...
Or there may be a robbery they should be responding to down the street that instead they're having to, take some elderly man to jail. Or
to a mental health facility that the person may not want to go to.
And let's talk about that, because there's not a lot of mental health, though, right? Like, so they'd be dropping them off at the ER?
They'd be dropping them off at the ER,
And what's that effect have on hospitals?
Well, it just, again, with the changes to the Medicaid out of the HR1, it's going to do uncompensated care onto the hospitals. Your emergency rooms are going to be bogged down.
So small rural hospitals can't afford this.
And it's just going to continue to burden the system for something that really an individual, if you just let them live and be safe where they're at and connect them to social services, we can get them all moving.
So it sounds like you've got the sort of federal pushing down, and then we're seeing ordinances even popping up here in East Lansing to criminalize homelessness. What do they look like? What is it? It's things like loitering or sleeping. It's not like thou shalt not be homeless, right?
It's everything from, panhandling, can't be within a certain distance of a bank and panhandling, can't can't sleep on the streets, park benches, can't have, I've even heard of things like you can't have a grocery cart in parks. It's targeting behaviors or things that you see homeless individuals do. That's the criminalization.
And I want to keep talking about this for just a minute. I know you also worked for Senator Santana. There was a very public case of babies that froze to death.
Yeah.
In your experience, is that something we're seeing? Is more people dying on the streets because of the lack of services and a fear of coming in because of this criminalization?
And what you're exactly right. As we continue again if we push vulnerable populations further and further to the edge, it's harder to get to them, to connect them to those services. So you're going to see more individuals dying because of cold weather injuries or just having a heart attack or stroke. And so those first responders can't get to them, make those connections. So you're going to see an increase.
So I know we say this in the office, but I think it's important folks hear it. More people are going to die because of these policies.
Correct.
At the end of the day, this isn't some sort of abstract intellectual conversation. This is people will freeze to death. There will be less people, less law enforcement able to help with real crimes, and we will still have this issue.
Correct. I hate to say, yeah, you're right. It's when we boil it down to that, that's really what it is.
So when you go out to the camps, what do those folks want? Or what do you say to people who say, yeah, but I can't have 15, 20 families living, in the woods next to my business?
Yeah, I agree. I don't want people living out on the street either, but we have to do this by, like what you were saying, is invest in where we know programs work. We also have to understand that everybody remains on the street for a different reason. They may have a dog. Dogs aren't allowed into shelters. They may have for a woman or a young man, they may be partnered with either a older individual or a friend that can't stay in the shelter with them because of whatever reason, different sex, different age. And it makes it, they don't feel safe without that person.
So my background, is in trauma-informed care. So I think one of the things I want folks to know is it's not a quick fix, because if I showed up, I'm from the thumb. If you showed up, Nick, and said, I want you to go to this shelter, sleep next to 20 people, and they have all these rules that, says that you can't have your dog and you can't eat when you want and you can't use the restroom when you want, I'd be like, you know what? No.
Right.
So trauma-informed care is developing relationships. That's essentially what we both believe, right? Like, you develop a relationship, you find out what the first person needs, and then you figure out how to get them into housing first.
Right. I mean, you hear people say, I know you've heard this.
Oh,
people say, there's individuals that don't want housing.
They choose to be homeless. That has got to be the biggest myth I hear. They might choose to reject what you're offering because sometimes our shelters aren't in the best spot because what is the daily rate that we're currently paying?
$19 an hour per diem.
I ran a homeless shelter 12 years ago. You know what it was? $19 per day. So that means the shelters get $19 per person, right, to house somebody. And so they're not always good places. Now, you might say, well, if you're freezing, you won't have any, that's your best choice. One, they're often crowded. Two, they're sometimes not safe. And three, maybe I wouldn't make that choice.
Yeah. I mean, and at the end of the day, I think we just understand each person's different, and we have to treat them with dignity and respect and let them, give them choices, options, listen to them, like you were saying with the trauma-informed care.
And we have to have somewhere for them to go. Right. So as we look at solutions, and I think this is sort of where we have to sort of talk about, and hopefully for our next podcast, we can continue to talk. Solutions are, we need more affordable housing, not middle income, not $300,000 housing, but housing people can actually work and pay for.
For the extremely low and low income
housing folks. We need more funding for street outreach. We need more funding for youth, because we know they're struggling, and our veterans. Yeah. And as we look at those things, people are going to say, okay, you've convinced me. How do we get involved?
Yeah. And I think that's, what your job as the Senior Director of Advocacy and Engagement. Why should people, one, listen to this podcast, and two, why join MCAH? What do we bring to the table?
So MCAH is great. It's my favorite job, and I've had many jobs. I've had fancy jobs. I've had, grassroots jobs. MCAH has a good balance between knowing exactly what's happening on the street and understanding. Nick has great access to the legislature, so we get to do both. We get to do policy, and we get to understand what's happening, really what's happening with people in Michigan. And we are very Michigan focused. We're about our communities. So join us. We're a statewide membership organization. And there is a cost, but if you join, you get to be on our listserv, you get trainings, you get updates, you get to listen to Nick and I, you get access to Nick and I, and we are really, we have a training program, we have a series of meetings called Bridges to Belonging, where we talk to other allied professionals.
Well, I think that's a great thing, is that Bridges to Belonging. Could you kind of go a little bit more into that about who joins that?
Well, pretty much anyone who's interested, from medical professionals to lawyers to artists to bankers, anyone who cares, who gives a damn. And one of the things we're focusing on are sort of how the HR 1 effects are going to affect low-income folks.
Because there's going to be kind of a trickle down on that, right?
Right. So our next podcast is going to feature someone who's going to talk about food stamps and how food stamps and how food insecurity is going to affect precariously housed folks.
Yeah.
And all of us in Michigan, because it's also going to affect folks who grow food and the ability to sell it.
Well, and also your people that are, your senior citizens rely a lot on those programs for nutrition.
Right.
Which then leads to increased health costs.
So one of the reasons you should listen to our podcast and join MCAH is because we're going to tell you the truth. We're unhoused and unfiltered. We're going to tell you what's actually happening for working class and low income folks that you're just not hearing when you tune into sort of what I call the white wine podcasters, where you're just like, okay, this is a great intellectual conversation, but nobody actually talks this way.
Right.
We really are boots on the ground. And please consider joining us, listening to our podcasts, and really lifting your voice, because this is your community. I'm from, I spent my summers in Oscoda. It's a really small community. I'm from the Thumb, and I know the folks I grew up with, and most folks in Michigan do too.
Yes.
We're a community in Michigan.
Yeah, I mean, if you think about it, I joined the Army right out of high school. I lived in New York, Kentucky, Kansas, Germany, went all over the country.
But there's nowhere like Michigan.
But when it was my time to get out of the service, I came back home because of that connection, that community that we really, Michiganders.
I guess there's an actual rule or law on the books now, but I'm not a goose, so.
Yeah, well, when you have two policy dorks sitting
Michigan. But to be honest, I don't think there's anywhere like Michigan. When I see the conversations around flyover country, I know that I can sit down with somebody, a cousin who maybe is completely on the other side of the aisle. We can still talk about stuff that's happening in our communities and agree that when your car breaks down, he's still on the side of the road, he's still the guy that's going to give me a tow.
Yeah, and I think that brings up a great point, is on the politics side, we are a purple state.
Yeah.
We are completely purple. When I'm on national calls or when I'm on national meetings, and they say, well, our Republicans, our Democrats, this is the conversations we're having. I'm like, I wish I could help, because I'm talking to Republicans one day, Democrats the next, and it's
Mike is a purple art agency. We believe in a bipartisan response that is practical, which is not something you get sort of in this current environment, which is another reason to become part of our community.
And we represent everywhere from Detroit, which has urban homelessness issues, to Marquette, which has rural. and everywhere in between.
And we can highlight some of the remarkable work that's going up in places you don't know. There's an agency called True North that's working with the DNR to help folks who are camping long-term in the federal forest. They're remarkable people. Like, they're just extraordinary people.
And like we were saying earlier, is our service providers don't toot their horns enough.
No, because they're too busy going on 2 tracks in the middle of the winter trying to find unhoused folks.
No. So, I think this is going to be the beginning of a great conversation. Micah, we're always around. We have the Legislative Action Committee.
Yep.
The first Monday of every month at noon. It's where you get to hear me give federal and state updates and policy updates, and sometimes even bring in guests to talk about what trends are happening nationally or across the state. And then, Bridges to Belonging.
Right, which is monthly. We also, and if you want to join any of these, you can go to our website at, what is our website?
Micah.org.
Micah.org. Sorry, I had a moment.
We really appreciate everybody that tuned into the podcast. We'll continue to develop these as we go. This is our first one.
Yeah.
Well, that's why we're unhoused and unfiltered.
And we can be pretty unfiltered. So
yeah.
we'll continue to work on our podcast and our structure, but we welcome you and we welcome feedback. Contact us, call us, just let us know you're there and that you're interested.
Yeah, I think we're the 2 most easy, accessible people at Micah.
That is
and we love to talk to you. Reach out to us at any time. If you have any questions, concerns, or even want to give us an idea for a podcast.
Please, absolutely. We would, I would be excited just to hear what folks' thoughts are if this is something that you're interested in.
Thank you, and we really appreciate you joining us today. I'm Nick Cook, Director of Public Policy for the Michigan Coalition Against Homelessness.
Sarah Rennie, Director of Advocacy and Engagement.
Thank you for joining us, and we'll talk to you next time.